The most effective use of abdominal ultrasound imaging is to scan all organs and structures and not just a few target regions. All too often, unexpected ultrasound findings have an undue influence on our decision-making process. The order in which you evaluate the abdominal structures is less important than simply using the same order each time you conduct your exam. By using a systematic approach from start to finish, you'll avoid making hasty conclusions whenever you identify something unusual. Also, by using a systematic approach to scan the entire abdomen in all your patients, your level of proficiency and confidence will grow more quickly. Ultrasound is a technique that requires a lot of practice, so the more and better you use it, the more comfortable you will feel. There are many different approaches to ultrasound exams. I will be simply presenting my own examination routine that I've been using for the past 10 years. After a full abdominal shave, from the rib cage down to the pubis, the skin can be cleaned using gauze soaked with alcohol, before a generous amount of gel is applied all over the shaved area at the beginning of the exam. The gel will then slightly penetrate the skin and improve image quality. A convex or curvilinear probe is usually needed to cover the abdomen of a dog or a cat. A marker or pointer on the side of the probe will identify that side of the scan zone on the resulting ultrasound image. In this case, it's a pie-shaped section, with a thickness that varies according to the position and size of the focal zone. Organs and structures are scanned using two main planes. The first is the longitudinal plane, along the long axis of the organ. When using this plane, the probe marker is oriented toward the head of the patient. When imaging the left kidney, this means that the cranial pole will be to the left on the ultrasound image. After rotating the probe 90 degrees, with the marker to the right side of the patient, a transverse section of the kidney is obtained. The examination of this kidney, like most organs, consists of scanning from the lateral to the medial side in longitudinal plane, then from the cranial to the caudal end in transverse plane. Oblique planes will also be used for a complete scan of selected organs. The exam is started by placing the probe just caudal to the xiphoid process, in a transverse plane with respect to the patient, with the marker turned to the right side of the patient, which means towards you if you are right-handed. The marker should thereafter always be placed on this side for all transverse evaluations of the organs for consistency. Next, the probe is moved to scan the liver, dorsally to ventrally, and caudally to cranially, and then moved gently under the costal arch, toward the left to obtain oblique planes. After scanning the right side, the probe is rotated so that the marker is directed towards the animal's head in a sagittal plane. The probe is moved to the left and then to the right to scan the entire liver. Besides evaluating the liver parenchyma, special attention is given to the gallbladder and common bile duct, which empties into the proximal duodenum. Next, the probe is moved towards the spleen to scan the head located just caudal to the liver on the left, then the body and the tail of the spleen that are often found on the ventral surface of the abdomen. The tail may cross over to the right side in some dogs. The spleen is imaged in different planes. You can move on next to the left kidney, first in the longitudinal plane, then transversely. By moving the probe medially and dorsally to the kidney using a longitudinal plane, you will find and assess the left adrenal gland. Next, it's on to the bladder, which will be evaluated in the longitudinal and transverse planes. The urethra is more or less visible depending on the size and position of the bladder. In males, the prostate will be assessed at the same time. The probe is then moved cranially up to the costal arch and then dorsally and cranially to evaluate the right kidney in both planes. The right adrenal gland can then be examined by gently moving the probe even further cranially, dorsally, and medially, starting from the right kidney. Moving on to the GI tract and pancreas, the probe is placed in a transverse plane on the body of the stomach, and then moved to the left to cover the fundus, then to the right for the pylorus. Next, the same zone is scanned using a longitudinal plane in regard to the long axis of the stomach, with the probe placed transverse to the patient, moving to the duodenum, which is on the right under the costal arch. The duodenum is followed to the right and caudally, up to the level of its caudal flexure in a transverse plane. Then, a longitudinal scan is performed back to the pylorus. After identifying the stomach and duodenum, you'll be able to find the pancreas using these landmarks. First, identify the portal vein at the liver hilus in a transverse plane. The body of the pancreas will come into view ventral to the portal vein near the liver hilus and just caudal to the gastroduodenal junction. The probe should then be moved obliquely to evaluate the left lobe, then the right lobe along the duodenum, using transverse and longitudinal planes with respect to this organ. The rest of the small intestine, which means the jejunum and ileum, will be assessed by scanning the entire abdominal cavity in different planes. The colon is identified in the transverse plane dorsal to the bladder. From that point, the colon is followed from the pelvic canal to the cecum, scanning over the transverse and ascending segments. After scanning it transversally, a longitudinal plane should be used to complete your evaluation. The gas and feces in the large intestine will make it sometimes difficult to follow this final segment of the GI tract from start to finish. Move the probe over the rest of the abdomen to evaluate the fat tissues, peritoneal space, and lymph nodes. The main groups of nodes, namely the sublumbar and mesenteric nodes, are the most important ones to identify. The sublumbar nodes are dorsal to the bladder and run along the caudal portion of the aorta and caudal vena cava and the iliac arteries and veins. The mesenteric nodes are located in the center of the abdomen along the cranial mesenteric artery and vein. Finally, you may be able to identify the hepatic and pancreatic lymph nodes, although they're not often visible when normal in size. In intact females, the uterus is identified starting from the bladder, using a transverse plane so it can be more easily distinguished from the descending colon. As you move cranially, the uterine body first comes into view, then the uterine horns. Each horn can sometimes be followed all the way to the ovary, located just caudal to the ipsilateral kidney. In young, larger, or obese females, and especially during anestrus, the horns might be difficult to visualize. Ovaries can also be identified after locating the corresponding kidney. From a longitudinal plane of the kidney, the probe is then gently moved laterally and caudally to search for a small structure located caudal and slightly ventral to the kidney. In males, the prostate can be evaluated at the same time as the bladder. The testicles can also be examined in intact males. Access to certain structures in the cranial abdomen may be difficult in deep-chested dogs, or in patients with small livers or gas-filled stomach, requiring that you scan from between the ribs on the right side to complete your exam of the liver, the gastroduodenal junction, and the portal vein. You can also use this approach to evaluate the right kidney and adrenal, which are sometimes located further craniodorsally. A left intercostal approach can sometimes be useful to evaluate the left portion of the liver, the head of the spleen, and the gastric fundus.